All right, so I will be presenting on the effects of compression and cryotherapy on patellar tendonitis. So I had a 17-year-old female athlete competing in varsity high school soccer year-round. So she came into the AT room complaining of pain on her anterior knee. All tests came back negative, so we did anterior drawer, McMurray's, Lockman's, posterior drawer. Her range of motion was basically 100%. But she was tender while palpating right on her patellar tendonitis. So that's basically like a key sign and symptom of patellar tendonitis in an athlete. So as far as what patellar tendonitis is, it's also known as jumper's knee due to chronic stress and repetitive stress from the quadricep muscles, just from constant loading, from jumping, cutting, stuff like that. So it's described as generalized pain and inflammation on the patellar tendon on the anterior side of the knee, right where your patellar tendon inserts on the tibial tuberosity, right up to the patella. That's where you're going to feel most of the pain. And the patellar tendon is the essentially the insertion facilitator of the quad. So it's that band of soft tissue from the muscle belly of the quads to the tibial tuberosity where it inserts. So that now we're going to get into intermittent compression. So it's a technique of reducing edema and lymphatic drainage through pumping of air. Sometimes there can be chilled water coming through, but I'm going to get to that later. So the pressure is applied to the arm or leg and is increased to enhance venous and lymphatic drainage. So it also helps with blood flow to the area, and then it is repeated again once it is deflated. So something I'm going to be talking about that we use with this athlete is the Normatec leg system. So it's a full compression system that is designed to help the athletes recover and prepare. So it has 5 zones, 1 being the ankle, 5 being more proximal towards the hip. And it fills up one by one until they're completely inflated, and then it deflates and starts to cycle over again. I believe a cycle is about 15 to 20 minutes. So the goal is to assist in the lymphatic drainage and help get rid of any unwanted lactic acid, and also increases blood flow to the area like I just talked about. And their whole thing is train hard, recover faster. And it also can be used beforehand if your legs are feeling heavy just from previous training days. Or even a game, race, etc. the day before. So then into cryotherapy. So it's really the use of any cold ice, near freezing materials with the goal of decreasing tissue temperature. So it is used for decreased swelling, ecchymosis, acute injuries, or it's used on acute injuries, excuse me. And some examples would be ice pack, cold whirlpool, game readies, which is a segue into the game ready system. So it's cryotherapy and compression combined, used on the knee, shoulder, hip, elbow, etc. In the picture below, it's a little smaller, but you can see a game ready being used on the ankle. That's what the sleeves look like. And it is used for recovery in both injured and non-injured athletes alike, for recovery and injury prevention. Those are keys. So the compression works for lymphatic drainage and also bringing the cold aspect closer to the target area by compressing it. And studies have shown with Game Ready that one can achieve a 12 to 17 degree drop in skin temperature, that is in Fahrenheit, in about 10 to 15 minutes, which is about the same as an ice pack. I believe an ice pack is about 5 to 10, but still relatively quick. So the Normatec versus Game Ready, when would you use it? When would you use one over the other? So for the Normatecs, for everyday recovery, the body is feeling heavy and tired due to lactic acid and lack of blood flow to the area, and can be used before and after workouts, like I stated. So the Game Ready, it's for acute injuries and recovery when structures are relatively sore. So acute injuries, meaning that 48 to 72 hours, completing price easily. So protect, rest, ice, compress, elevate. You're already using 3 of those with the Game Ready, just setting it up. You're resting, you're icing, and you're compressing. All you need, and protecting actually, and all you need to do is elevate it while using it. And would recommend against using this before activity due to the severe drop in tissue temperature. We use both of these on the athlete Normatex were usually when she wasn't feeling as sore or before a game, and the Game Ready was after competition or practice just to calm down the tissues. So yeah, that's the